Chair of the British Medical Association, Dr Chand Nagpal. Dr Chand, thank you for joining us this morning. The government will say that they are just responding to the change in threat to COVID. Do you believe that they're potentially ignoring millions of vulnerable people then?
Yes, I mean, there's no doubt that we've come a very long way over the last 2 years in terms of the level of protection we've offered through vaccination and the fact we've now got treatments for COVID. And so we're in a much stronger place. However, we're certainly not out of the woods yet. We have 11,500 people in hospital with COVID. That's more than the 7,500 when Plan B was announced. We're still seeing, sadly, nearly 1,000 people dying every week. And also hospitalizations on a daily basis is more than 1,000. These are figures that are still quite high. Circulating levels are still very high, 1 in 20 people, according to the ONS, much higher than the daily figures because the daily figures now are not reliable because people aren't actually getting tested. So we certainly have not seen COVID go away. And our worry is that the message, if you tell the public that they do not need to self-isolate, is firstly, it diminishes or airbrushes the reality that so many people are facing, with more than 1 million who are facing long COVID symptoms. And of course, so many who are clinically extremely vulnerable and immunosuppressed, who will be at much higher risk of becoming infected if people are no longer isolating. And we know that in a country like Denmark that have actually eradicated or they've ended rules around isolation and other measures, that the cases have rocketed. So we think this is a premature decision. It's not based on data. And it's unnecessary at this moment when we should be protecting people. And the government hasn't put in place any of those explanations, but has made an announcement 1 month early, which we believe therefore becomes a political announcement, not one that's based upon the interests of the public's health.
Dr Chand, let's talk a bit about what this means for not only long COVID, but what this means for detecting other variants.
Well, one of the real worries here is that not only are we hearing about stopping self-isolation as a mandate, but also there's been a lot of talk that the government intends to stop routine testing and in fact charging for testing. And now if we aren't testing, we aren't therefore having proper surveillance, we will first of all not know the scale of infection in the community. We will not know about outbreaks. And the PCR test, which now is no longer the test that's offered if a person is symptomatic. It's now people are asked to do an LFT. The PCR test is used as a basis of sequencing the infection to know if there are going to be new variants. So we're now in a position or in a place where we're not testing to check for those new variants if we stop testing altogether routinely. So there's a lot of reasons why we should be certainly making sure that we can mix in society safely, and that's absolutely right, and people already are doing so. But to go further and stop testing, charging for testing, and also, more importantly, ending self-isolation, these are measures that do not make sense if the aim is to protect the public's health, in particular those who are vulnerable and those who may go on to suffer long symptoms of COVID.
Dr Nagpal, we know that Omicron was mild in comparison to, say, Delta. There are a lot of people that will want to just move on. What would be your message to them?
Well, we're very fortunate that Omicron has been a milder variant, and it's absolutely understandable that people who have suffered mild symptoms will think, quite rightly, what is the fuss all about? However, as a doctor, as a GP, I can tell you that there are significant numbers of people whose lives have been wrecked through long COVID symptoms. I have to make referrals for patients to specialist clinics whose lives have not been able to continue. They've not been able to work. So this isn't a flu. You don't have this sort of consequence with normal viral illnesses. It's a very real illness for more than 1 million people who've been suffering long symptoms. And that will continue to happen as more infections continue to occur. The second is about people who, again, as a doctor, I look after and doctors look after, who are clinically extremely vulnerable and immunosuppressed. We have to spare a thought for them. For them, COVID can be a serious illness. There are, as I said, nearly 1,000 people dying every week. For them, it's very real. This isn't an illness that has gone away, and for their families. People are in hospital. So I would say that we need to be able to mix in a safe manner, and self-isolation is part of that.
Thank you, Dr. Chand Nagpal, for your thoughts this morning on Sky News.